You know, we hear it all the time, mask up. It is a saying born out of the COVID-19 pandemic and the push to slow down the spread. But as cases climb and new variants emerge, some experts are suggesting we upgrade the quality or even maybe double up on the mask that we're wearing. WMAR2 News' Ray Strickland talked to a local doctor about the evolving mask recommendations.
Experts have long said a mask is one of the best tools we have against the virus, but now with the more contagious variants here in the U.S., there's a renewed focus on mask wearing, with some health officials even suggesting for you to double up to better protect yourself and everyone around you. There are now reports of the highly contagious UK variant of COVID-19 in at least 30 states across the U.S. According to the CDC, there's already been more than 300 cases, including 4 in Maryland, and at least 2 states have confirmed variants from South Africa and Brazil. These new variants have public health officials stressing the importance of mask wearing. For months, they've said it's the best tool against the virus until we reach herd immunity.
These new variants are more transmissible, although they don't appear to be more dangerous. They could certainly increase the number of infections that we have, even while we're rolling out the vaccine.
Dr. S.D. Shabelman is the chief medical officer at Sinai Hospital in Baltimore.
The most important thing you can do is wear your mask correctly, right? Over your nose and mouth, make sure it's sealed along the sides.
The CDC has recommended wearing a tight-fit washable mask with at least 2 layers, but some experts, including Dr. Anthony Fauci, are suggesting double masking as a more effective way to slow the spread of the virus.
I think the best thing you could do is get a high-quality 3-ply mask. I think that's step one. If you can't do that for whatever reason, then wearing a cloth mask on top of a surgical mask might provide some benefit.
We spoke to one woman in downtown Baltimore who said she wouldn't be opposed to wearing 2 masks if it means bringing an end to the pandemic.
To slow the spread of COVID, I'm willing to do anything I can do. I've had family members who have passed from COVID.
And there's also some confusion about if you should wear a mask after you get the vaccine. Dr. Shabelman says absolutely yes, and that's because experts do not know if the vaccine prevents you from spreading it. He says we are inching closer and closer to the finish line, and now is not the time to let our guards down. Reporting in Towson, Ray Strickland, WMAR2 News.
So tonight on Facebook, we asked you if you were willing to double up with your mask based on these recent recommendations. Some said no, even joking, what's next? Plastic covers or a bubble suit? Log on and let us know what you think about the double mask recommendation.